Overnight, Israel carried out multiple airstrikes on the southern suburb of Beirut after ordering people to leave the area or then risk being bombed. Explosions were heard across the Lebanese capital. At least 4 people, including a child, have been killed, and one of the strikes hit near the Rafik Hariri Hospital. Residents have been fleeing the city as the Israeli attacks intensify. Our correspondent Charles Stratford joining us from Beirut this morning. So, Charles, it was a violent night of Israeli airstrikes on the capital, targeting even close to a hospital. What's been the aftermath of that?
That's correct, yes. The Lebanese authorities saying there were at least 13 Israeli airstrikes, mainly on the southern suburbs of Beirut last night, at least 1 so far this morning. 4 people killed in one of those strikes, including a child, as you said. Now, that strike was very, very close to the Rafik Hariri Hospital, the hospital that is still functioning. It is still receiving patients. As you can imagine, hospital staff there working under very difficult conditions. The strike, certainly according to the Israelis, was targeting what they describe as a terrorist, very close to the hospital. The impact site, we understand, was a cafe across the road, and we've seen pictures of the damage done to the hospital entrance. With respect to the fears, the mounting fears here in Lebanon that we might be beginning to see Israel now targeting medical facilities, as of course we've seen happen in Gaza, there was also a statement put out by the Israeli military saying that a hospital called the Sahel Hospital, which is in the Dahia area, the southern suburbs of Beirut, was in Israel's word, a cash bunker for Hezbollah. They're saying that there was cash being stored, we understand, certainly according to Israel's statements, in the underground areas or underground facilities of this hospital. Well, you can imagine the kind of reaction that brought from the Lebanese authorities. There was a statement put out by the Ministry of Health almost immediately after that warning, and condemning the attacks and threats, saying that it reflects Israel's persistence in continuing war crimes that disregard all humanitarian and international law. That statement went on to say that they appeal to the international community to abandon what they describe as a policy of silence regarding what has happened, what is happening, and what may happen. Now, Israel says that it will not attack that hospital, the Sahel Hospital, but it says that it is monitoring the situation. So, yeah, an indication last night of a possible change of strategy now by Israeli forces in potentially targeting medical facilities in Lebanon.
Okay, thank you. Thank you so much, Charles Stratford, for reporting from Beirut. Well, we can now speak to Zaina Salhani, who's an operations manager at Humanity and Inclusion in Lebanon, joining us as well from the capital, Beirut. Thank you for your time. I know your teams are responding to the emergency in Lebanon. What are the priorities right now?
Good morning. Yes, that's true. While I'm doing this interview, the team and the partners, they are trying to be responding to the demands and the needs to the displaced people in Beirut, Mount Lebanon, and the north and all other areas. For the needs, here now we are talking about massive needs. Currently, the humanitarian situation is witnessing a very quick deterioration, because also we have to take into consideration that with the displacement of more than 1.5 million people into what is called safer areas, also we have to consider that Lebanon is still witnessing the economic collapse, where over 80% of the population, they are below the poverty line. And also we have to take into consideration that this country is hosting over 1.5 million Syrian refugees and operating with a collapsed healthcare system, which make the situation even more and more difficult.
So in terms of, though, the priorities of these people who are now being forcibly displaced by these forced evacuation orders, what do they need the most?
First of all, there is a comprehensive needs because they need everything. But if you want to prioritize, the first priority comes is the shelter, especially that there is hundreds of people being in the streets because there is no places to host them.
Okay, so shelter is then one of the priorities, and from an operational viewpoint, what are some of the challenges that you are facing as an organization?
Yes, actually, the first challenge that we are facing is the security concerns because now it's risky for some of our team and the operational team to be working because we don't know where are the safe locations, and so can be considered the first challenge. The second challenge is that we are facing a massive and increased needs and demands, all types. As humanity and inclusion, we are more focusing on people with disabilities, on elderly, to ensure that they are not left behind in this emergency situation. However, this puts us in a situation that people they need for other needs, and they are not considering people with disabilities as their priority. So this is something that we have to pay the attention for and to work very hard to ensure that these vulnerable populations are not left behind.
So what impact do you think this war and this emergency is having on those people that are already incredibly vulnerable?
Mainly for people with disability. Here we are talking about the physical well-being. There is malnutrition. This is very significant, mainly for people with disabilities. And here we are talking about all ages. There is a limited access to health care. They are not getting their medication. They are not getting their rehabilitation services. Many of the displaced people, they came out of mainly from the areas in South Lebanon without their assistive devices. Some of them with the chronic diseases, they came without the prescriptions. So this is at the level of the physical impact. However, for the psychological impact, here we are talking about stress and trauma, and also we are talking also about exploitation. And here I want to highlight the people who are not living in the shelters. They are the people who are living in streets, where these people, mainly the people with intellectual disability and other types of disability, are facing exploitation conditions.
Okay, thank you so much, Zaina Salhani. Thank you for speaking to us from Beirut.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.